Hi, welcome to the Verto Health webinar on vaccination appointment booking, working in workflow automation. Just a heads up, I have the FedEx guy who's messing around on my front step, and we have dogs, and so if you hear a little unusual noise in the background, that's what the nature of that issue is. I'd like to welcome everybody to today's presentation. I'm very grateful to be joined by Giuseppe Cammisa and Dr. Michael Anderson. We're going to be talking about four primary breakdowns in today's presentation. We're going to be talking about what are the core primary 4 or 5 issues that most health systems are facing in trying to manage vaccination appointment booking, especially in the context of some of the dynamic supply changes that we're seeing recently. We're going to be talking about how the solution was deployed with Giuseppe's team at Unity Health. So the real day in the life, here was the before picture, here's the after picture. And then we're going to go through a detailed overview of some of the actual screens and functionality. And we're going to end up and we're going to leave time at the end for questions. If at any point during the presentation you have a question, by all means, submit it via chat. And then we'll have contact information at the end of today's presentation if we run out of time and don't get to your question, to allow you to either ask your question subsequent to the presentation or book a live demonstration yourself. And then we'll also be sending a recorded version of today's presentation to anybody who can't stay for the full 30 minutes. So I'd like to start with introductions. Giuseppe, would you like to give a little background about your role at Unity Health?
Sure. Thanks, Jim. I'm Giuseppe Cammisa, Director of the IT Project Management Office at Unity Health, which is comprised of St. Joseph's Health Center, Toronto, St. Michael's Hospital, and Providence Healthcare in Scarborough. And I've been working closely with the Verto team on many different initiatives, but in particular for the vaccine clinic for just over a month now on our deployment. So happy to be here.
Thanks, Giuseppe. And you guys have 3 vaccination clinics currently deployed, is that correct?
Correct, across all 3 sites.
Super. And we're also automating the some of the COVID testing sites for your team as well. Is that correct?
And we leverage Verto for our COVID assessment centers at St. Michael's and St. Joseph's. Correct.
Fantastic. Great. Dr. Michael Anderson, would you like to give a little intro?
Hi, I'm Mike Anderson. My clinical practices are surgical oncology and palliative care medicine. I work in the School of Public Health at the University of Toronto in the Department of Surgery. And Verto's Chief Medical Officer. I got involved with Verto years ago when we were trying to manage complex cancer patients through challenging, complicated care journeys. So, thank you.
Thank you, Michael. Okay, so here's what we're here to talk about today. We're here to talk about kind of the end-to-end workflow for vaccination appointment booking and workflow automation. Let me be really clear. This is all of the capabilities of our solution, that we can handle it all the way from pre-screening, who's actually eligible currently based on the limited vaccination supply. There's a few different ways that we can do that pre-screening. We can capture pre-registration information, allow people to book their appointments, send reminders. We can send them patient education information as part of those reminders. We can also visualize for the vaccine clinic staff where is a patient in their workflow. So how many people booked today? What's our no-shows? How many people are in the vaccination rooms or in the drive-through testing vaccination sites? How many people have exited the process? What are the exceptions? Kick off automated notifications to clean vaccination rooms after the patient has exited, et cetera, et cetera. You don't have to implement all of this. You can roll this out in a phased manner. If you have really huge incoming volumes and your phone system is tipping over, then you can solve your short-term problems and then roll out additional capabilities, or you can just select the capabilities that you want. For those of you who aren't familiar with Verto, we certainly have some online appointment booking and pre-screening solutions for vaccinations and for testing, but we also have a COVID safety reassurance platform. So we think of COVID safety as a life cycle. Have you been tested? Have you been vaccinated? How are you doing with your antibodies? And then we expect that after the vaccination cycle, there's still going to be some serology antibody testing and then further booster vaccinations. And then we are at our core an interoperability platform. So connecting with your EMR, Epic, Cerner, Meditech, NextGen, that's part of our native skill set. And so in addition to the appointment booking and workflow automation solution, we certainly have additional capabilities from a connectivity perspective. So I'm going to turn it over really briefly to Mike Anderson and Giuseppe. We'll give about 5 minutes, and we'll talk about, before we get into the actual solution profile, what are kind of the macro challenges around effectively managing vaccination deployments for the health systems? Michael, Giuseppe, I'll let you guys take over.
I might start with a really, a bit of an obvious statement, which is this vaccination program is remarkably complex. And it's complex because we have multiple vaccines. We have different prioritization of cohorts of people who are getting vaccinated. Often they require multiple doses, questions about revaccination schedules. And then to make it even more interesting, and anyone who's sort of been reading the press lately knows that there's supply chain variability, which may go on indefinitely. And in public health, so for us to sort of return to normalcy, we need a high rate of vaccination. And in essence, we need a lot of the people who are vaccine hesitant to buy into this. And the challenge is that public health measures revolve around communication and trust. And I'm often reminded that years ago, a colleague pointed out that, if you hop on a plane and you notice that the seats are dirty and there's gum under the tray, it does make you wonder if they're taking care of the engines and the wings. And I think we need to instill confidence and build trust with the public at large to ensure that we get a high rate of vaccination. So what are the big challenges? Well, one is doing this, one needs to be adaptable. There's changes in eligibility prioritization. There's changes in supply chain, and there will be regulatory changes. We sort of don't really have a crystal ball into entirely what the future holds. So being adaptable is important. I think intelligent scheduling is actually really important. The workload involved in scheduling and rescheduling and manipulating large populations of people, especially as this scales up, is profoundly labor intensive and administratively challenging. So we need people's ability to auto schedule. And then the one that we're seeing right out of the gate is that when there's variability in supply chain, you have to be able to mass reschedule, essentially turn on a dime. And to do that by hand or administratively is prohibitive.
And so Giuseppe, sorry to interrupt, Michael. Giuseppe, what have you guys seen from kind of the people who are actually executing on this? What have you seen in terms of, your vaccine supply is over the quantity you expected or under the quantity, and then, or it's delayed by 3 days, and then it's not just all or nothing, right? I had 3,000 appointments scheduled, so let's just push all 3,000 back. It's this ethical rescheduling based on prioritization. Can you speak to kind of what you guys are experiencing with that so far?
Yes. So I think the key piece, and anyone that has launched a vaccine clinic right now will know that the criteria and kind of the landscape changes on probably an hourly basis, not even daily basis. So when we started off, the direction was hold back second doses, and then that changed quickly. Increase your clinic hours, don't hold back second doses, and now we're moving into the phase with we're running short on supply, you may need to delay second doses. So having a tool that allows us to be nimble and to move as changes in supply chain or direction from the ministry has been helpful. So at certain times, we've had to increase the number of appointments and kind of do a blast out and try and get folks scheduled in under 24-hour notice. So we've been able to release a block of appointments in doing so with the Verto tool. And now we have the case where, and we still don't have firm, clear direction, but preparing for those that have second doses coming up with supply shortages, how do we reschedule those and how do we do it ethically? So are there certain groups we need to prioritize within a certain window? Are there others that we can push out to the 42-day window? We're starting some of that pre-work, but knowing that there may be a tool available that allows us to pivot and be able to change that will definitely help. Just recognizing we don't have all those answers. So I think that first piece with adaptable is probably the biggest one, that there's been changes in prioritization eligibility, and for good reason. And having a tool that automates some of that workflow will definitely help, so that we can actually do that quite quickly and nimbly without missing or causing issues in doing those changes.
That's great. Thanks, Giuseppe. Sorry, Michael, I didn't mean to interrupt.
No, that's perfect. Come anytime. So I think that that speaks to the complexity of this, and I think Giuseppe actually brought up a really important term, is that ethical priority setting. Is as we go through, we're not saying vaccinate everyone at once. We're trying to do it in a fashion that makes some sense based on ethical priorities. That will change over time. So the scheduling is always a moving target, and we need to be very nimble with that. That sort of leads to the next piece, which is engagement. So if you're changing, adapting, we have to be able to communicate with the people who are lined up for vaccination. Things have been moved, things have been changed, we can expedite this. So the ability to engage and connect to the people in the vaccination queue is profoundly important, particularly if you're shifting things. And you can imagine if you had 200 a day to change, it's tough. If you had 1,000, it's daunting. And if you had 5,000, it's insurmountable. So an ability to engage and be nimble around your populations is crucial.
Yeah, without someone having to make 3,000 outbound calls, right? That's one of the things that we're going to be here to talk about today.
Yeah, we certainly heard in the screening clinics that when you are trying to manage 1,000 calls a day, it takes about 2 days for your staff to revolt. So that's a real challenge. Also an education piece around that. This is not a straightforward one and done. So there's aspects of this that communication has to be pretty bi-directional and nimble. The last one of the next ones is really that sort of reporting and visibility piece. That there's a lot, and we don't even know at this point all of the potential places one will need to be accountable to that they've been vaccinated. I know in my clinical practice, my institution recently sent out an email to us saying, please let occupational health know that you've been vaccinated. Have you had one? Have you had two? I can imagine there may be requirements as a professional to report to professional regulatory bodies. Certainly the potential need to report back to government, to even studies at large, because this is, in some respects, this is an ongoing observational experiment about when do we need to revaccinate people. So the back end of this, the reporting, isn't entirely clear yet, but having the flexibility to connect and report to multiple entities, I think, is going to be pretty crucial. And Giuseppe, I don't know if at Unity yet, if there's some clarity about what that reporting, what information needs to come out of this, or if it's something that's evolving as we go.
Yeah, I think right now we know the capabilities there technically. I think we're getting in line what can be shared and with which bodies. So we're just being, it's more so probably on the policy regulatory side with what can we share, recognizing some of this information is considered PHI.
Yep.
In that regard, but knowing that if it does come to a point where we do need to share this with our occupational health bodies, we have a way of extracting that data so we can update our corporate health systems. So it's good to know that capability is available, even if we can't do it right now as we're figuring out the policy piece.
Yeah, and the ability for our platform, again, as an interoperability platform, to export in a standard COVAX output format and things like that. That's certainly also something we'll talk about. Okay, so I want to move things along to make sure we're staying close against our agenda. So Giuseppe, I'm going to get you to talk a little bit about kind of the before picture before you implemented the Verto vaccination automation solution. What were kind of some of the challenges that you were facing?
Yeah, happy to do it. I talked a bit about this with Mike, so I'll try and flip through these quickly, Jim. But I think one of the key pieces, again, was not knowing, it was the need for flexibility and not knowing what was coming up. And the Verto tool seemed to allow us to do that. So one of the key pieces we knew we never wanted to actually even venture on when we were starting our clinic was the manual appointment booking, just recognizing the human resources that would be required there. So something that allowed that self-booking was critical to us in starting our clinic. We, as mentioned, we had success with leveraging the tool in our COVID assessment center, so knew that there was scalability to use that tool in our vaccine clinic. I think the one key piece as well was just with the need to fill those spots as quickly as possible, having to do that through manual phone calls would not have allowed us to move as quickly as we did. So giving the staff the ability to go in and book their own times and do it at times that were convenient for them. Oftentimes they maybe didn't find a convenient time, but that was likely due to just the fact that there was a limited amount of supply, but they could at least schedule based on what worked for them. And I think the key piece there again is being flexible with the eligibility criteria. So we started to segment our blocks based on long-term care, and then when we got into our acute care workers. So ensuring that once we opened it up to acute care workers, we weren't taking up all the spots that were available for long-term care and retirement homes, which were our priority group. So the system allowed us to do that, and also gave the flexibility to reserve some spots in the back end for our admins to go in and book if we had any call in. So we may have got an urgent request from one of our long-term care retirement homes and they were fully booked. We had some flexibility in the back end to accommodate those last minute. So I think that was a huge piece that helped in setting up our vaccination clinic.
Super. And if you want to talk about again, then what was kind of the after picture?
Yeah, so again, we were able to deploy. I think we found out we had about a week's notice that we were opening up a clinic, and the solution was there before that, actually, because we needed to give people time to actually go in and book. So we were able to get it up and running in less than a week. As mentioned, staff were able to go in and book their own appointments based on their availability. I think the other key piece was, and we talked about this with the appointment reminders and education, everyone that signs up gets to request either the reminder through SMS or through email. In that, we were able to embed links to some of the consent material, information about the vaccine, what we asked them to do before coming on site. So it actually helped us expedite the process. So people were informed prior to coming to the clinic. They had the information available. One of the key pieces as well was the need to book that second dose appointment. So after you've checked out and kind of got your first dose, it'll automatically book you 21 days later at the exact same time. And this was something we actually worked in our favor because we didn't want to allow a lot of flexibility with that second dose, as we knew it would provide some logistical pieces. So there's still the opportunity. If staff need, they'll call in and we'll reschedule their second dose appointment. But wanted to make it as easy as possible to ensure that they were booked for that second dose. And again, the export report. So we have to do daily uploads into the COVAX system. And so getting an export from Verto with all that information really makes our uploads into the COVAX system quite easy. We've now moved to not even doing it the night before, we do it the morning of, which allows us to get the most up-to-date information into the COVAX system, making that check-in process a lot easier.
That's
and I think
awesome.
just
And
the
go ahead.
yeah, the last piece just to mention that we're working with right now is this rescheduling piece. So I think one of the key pieces the Verto solution will allow us to do is actually send out a quick communication blast to let people know that their second dose may be rescheduled. And once we actually have confirmation of when that is, we can do the communication out with their exact appointment details. So it's, again, right now with I keep going back to the unknown and kind of anticipating what's next. Being able to communicate out to say you may have a change in your second dose, stay tuned. And then when that new appointment's booked, they'll actually have the confirmation details automatically without having to fan out to thousands of people for their second doses.
That's great. Thank you, Giuseppe. And I'll just call out that the 21 days is because Unity Health is primarily getting the Pfizer vaccine, but we certainly support different time increments. For Moderna, if it was 26 to 28 days, or the other manufacturer vaccines as they come out. Okay, so let's get into some actual screens. Now, this is going to be a really quick drive-by, so if you'd like your own personal demonstration in a little more leisurely pace after today's presentation, then just reach out via the contact information in the last slide, and we're happy to set that up for you. So what we're basically going to deploy is a widget that'll sit on your existing website. So the whole idea is we're not going to make them go into a portal or download a mobile app or do something kind of arduous. They're just going to go to your website. There will just be a simple frame on your website where we'll have embedded our booking widget. The booking widget can consolidate. So if you have 3 different vaccination centers, you can have one central booking site, and then based on the pre-screening questions, we can guide them to the appropriate vaccination center based on the answers to their questions. But as far as they're concerned, from a branding perspective, this is a booking widget on your website. They're dealing with your healthcare organization. Once they've answered their pre-screening questions, and again, you can do that, secure that one of 3 ways. You can screen them based on pre-screening for who qualifies based on the limited vaccine supply. You can give us a roster where we will send out secured communications via that roster that'll have a token in it that'll recognize that user. Or you can simply send them a private URL and a private code to put in order to access the booking widget based on the specific prioritization that you're currently doing. And then you can change that as time goes on. Once they get to the booking widget, they basically give you their pre-registration information. That can be health card, personal information, whatever you want to collect, insurance if you're in the US. They'll get to the days that have the slots available. Here's the booking slots. You'll see that there's the quantity of booking slots available in each of those time slots. Right now, this particular example has a 15-minute increment. You could have some time blocks with 30-minute increments if it's 2 people coming or a family, or some time blocks that have 15 minutes, and you can set that time increment to whatever you want. It can give me global consent information steps, and then my real-time confirmation of booking. Right, so some of the other solutions queue the confirmation, so you get rid of the calls with automation on the front end only to get those calls back with people saying, hey, did this successfully book? We'll actually send that confirmation in real time. Then here's your reminders. Something really interesting happened with the testing and assessment centers that'll happen when we open this up for vaccinations to the broader public is they were getting a good portion of no-shows, because what people would actually happen, despite how critically limited both testing and vaccinations are, is that they would book at one site, find an earlier, more convenient slot at another site and book it and not go back and cancel the other site. So certainly the reminder is important. Hey, Bob, don't forget 2:30 next Wednesday, you have an appointment. But you'll see in the message on the right-hand side, it's click here if you want to reschedule or cancel. So the ability of prompting the user to make sure that they don't want to cancel or reschedule to minimize no-shows is also a critical part of this process. That cadence for how often you send those reminders, 3 days in advance, day of, 4 hours in advance, totally defined by you guys, as is the content in those reminders. You also have the visualization of where is the patient population in that workflow. And so each of the labels on those buckets, scheduled, arrived, no-show, that's defined by you. How many steps in this workflow process? You have 3 steps, excellent, 3 swim lanes. You have 5 steps, 5. You have a different swim lane organization for your testing drive-through center, or sorry, your vaccination drive-through centers versus in clinic. Again, you can have 2 different dashboards for those different workflows. And then the important thing isn't just the visualization. I can see where all of the patient subsets are in that process. It's also that intelligent workflow can be kicked off. So if, for example, you have someone who has entered the facility, they are in a vaccination room, they've now exited the vaccination room, you can kick off intelligent workflow to the cleaning staff to say, hey, this vaccination room is now empty, time to clean it. If it hasn't been cleaned in 10 minutes, kick off another notification to make sure you're maximizing throughput and capacity. The scheduling of slots is highly configurable by you. And again, the forms configuration editable by your internal teams, the workflow configuration editable by your teams, the slot configuration editable by your teams. We're trying to make people as self-sufficient as possible so they can be very dynamic and responsive as changes happen. And so this example we have a bucket of slots for staff. We reserved one for, I'll call it assisted booking. Maybe there's elderly people not comfortable with using the online booking, so they're going to call in anyway, and I'm going to assist them with their booking. But it could also be, as you're doing prioritization, here are the slots for long-term care facility 1. Here are the slots for community care workers 2. Here are the home care workers 3. So you can actually have buckets of appointments available based on the different prioritization sub-demographics that you're creating. And then if for whatever reason, as Giuseppe had outlined, you're running a little behind, you're going to go extend your hours, you can add those extended hours in a minute, publish them, and they're immediately available. You also have full visibility into that client interaction and engagement. So if someone does phone you and says, hey, I didn't get my appointment confirmation, instead of having to go into the calendar, copy and paste it, find their name, where's their email address, send them an email, or phone them and read it to them. Basically, what you can do is you can click, if Bob Jones was in the top here, you can click on it, resend Bob Jones, and you're done. And there's a search bar to find Bob Jones at the top. Patient engagement, you may just want to send them information saying, hey, don't forget to bring a mask in your health card. You can also give them information that's more detailed, that's personalized. People over 75 may get different instructions than long-term care workers. People who have a child accompanying them may get different instructions than either of those subgroups. So being able to personalize that patient education information is also very important. Dashboards showing key metrics, so you can identify what the friction points are in your process. How many people are we going to see today? What's the percent of no-shows? How long does it take us to vaccinate someone? How long does it take us to clean a room? So now you can identify where are those spots in the process where things are kind of slowing down and allocate resources to make sure you're maximizing throughput. And of course, the standard government or COVAX output reporting that you can just export to that standard output format and then bring it into that third-party system. And if you really want to go full automation, you can QR code everything. Send them a QR code in their appointment reminder. They hold the QR code up in their for scanning when they show up with their phone at the vaccination site. Scan the door, that checks them into the vaccination room. Scan the door again, checks them out of the vaccination room. Cleaning team comes, scans the door again. Now the room's cleaned, available to book your next appointment. And you can do this in levels in a step process, so that if there are people whose phone systems are basically being overwhelmed by the incoming calls, especially when you open this up to the general public, then you can say, hey, let's just get the booking widget on the site. Let's get the standard pre-screening and workflow in place. Let's get the standard Kanban dashboard in place. We can stand that up in 2 or 3 days, right? Now that you've accomplished that, well, maybe you want to configure the questionnaire, break down the buckets so the different appointment slots available, do a little more prioritization. You can do that as a secondary step, or if you want to do that all at once, that's okay. Highly configurable solution. It'll just take us 6 or 7 days to do that. And if you want to do EMR integration, use the QR codes, then that's more of a, we'll scope those requirements, and then we'll determine time frame and effort in order to accomplish that. And that's basically today's presentation. So here's our contact information if you'd like to set up your own personalized demo if we don't get to your questions. Austin, I'll get you to start reading off the questions. We'll get to as many as we can. And then again, if we don't get to your question, by all means, we'll reach out and follow up. And if you want to share this information with other colleagues, we'll send you a recording in the next couple of days of today's session. Austin?
Okay, thanks, Jim. The first question is, if you implement Verto, can you enter those patients that have already had their vaccination or have had their testing in the past?
Yeah, so there's a couple different ways I can think we might handle that. One is you could import a roster, and then in that roster, you could identify which patients have already received their vaccine, and then they may be appropriate for scheduling a secondary booster. And then the other patients on that roster that you have imported that need both, you could put those in different categories. That would be one way of handling it. So that would be one suggestion. Trying to think, Giuseppe, Michael Anderson, can you think of another use case in addition to that?
We've had some so we had a use case where someone had it out of province and was due for their second dose here. So in those cases, they're few and far between. So we've been managing them through the admin portal and adding them in so we can track them through the Kanban dashboard. Yeah.
Super, perfect. Next question, Austin.
Yeah, so this is in regards to our integration. So the question is, you stated interface with Epic. Is this in regards to the scheduling, clinical, or another part? And if this is for an Epic system, or can this be for a healthcare company that contracts with a larger healthcare system, who we contract with that managers our instance as a sub-provider?
Sure. So there's two parts to integration. So technically, the answer is we're an interoperability platform. We have some patented machine-assisted learning integration technology, so we can do these integrations really fast. Normal Epic integration might take 5 or 6 months. We can do that in 5 or 6 weeks. And the other part of it is data governance. So technically, can we integrate to pretty much any module in the Epic solution? If it's a pull where we're pulling data, that's really easy. There's not really a lot of additional conversation required there. But if you want to push data into one of those modules, technically, again, the answer is very yes, it's very simple. But now there's a data governance aspect to that conversation. And so the technical answer is we don't care who owns the data source, LIS, HIS, OLIS, EMR, Epic, Cerner, Meditech. Those are all just data sources to us from a technical perspective. When you talk about returning data into a system, that's a data governance conversation. And so who owns that system and what team owns the data governance conversation? that's something that we'd have to map the specifics in order to have the conversation around how do we actually execute against that. Okay, next question, Austin.
So I think you have already answered this, but the question is, do we have an interface in place with eClinicalWorks?
I'll check the library. There's the many systems that we've already done integrations with. I'll find that one out and I will respond to that individual directly with the answer to that particular question if we already have that particular data source where we've done an integration with another customer.
Okay. Next question is in regards to appointments. Can we call forward our clinic number to the Verto system once it's handled at our company? Or is there a different phone number for people to call, as well as for the company's email addresses for their programs as well, for both testing and vaccination?
I'm not sure I'm understanding the use case there. Giuseppe, Michael Anderson, do you have familiarity with that?
So what happens in the appointment reminders, if anyone needs to reschedule or cancel, we're asking them to call numbers within our clinic. We want our clinics to manage those. The reason for that being that your second dose needs to be done in a certain time frame. So we don't open that up for our end users to be able to reschedule their second dose. It's something we do internally, but it's our clinic teams that are managing the phones coming in. But the resources compared to some of the other vaccine clinics we know that have opened up are a fraction of the size to support those phone calls.
Okay. Yeah, if this is about call centers versus using internal call teams, again, for us, because we're a SaaS web-based application, accessibility to the application is simply about who you give appropriate security rights to and login access and have them authorized appropriately. If that's the question, then that would be another part B to that answer. And again, if there's more nuances to that particular question, we're happy to discuss them in detail directly with the person who's asking that question. Next question.
Sure. So the next question is the second dose appointment able to be adjusted for Moderna to 28 days, for example, or another selectable date?
Yes. Next question.
Next question is, can we overbook to a standby appointment to fill in no-shows?
That's more of a use case question because you can book as many appointment slots for a particular time as you want. And so one of the use cases is, if there's 100% of the actual appointments available, then you can reserve 20% for, booking against assisted booking or something like that. Giuseppe, do you guys have any use cases where you're actually on purpose, you're overbooking by 10% just to accommodate for no-shows or something like that?
So no, we haven't been doing that. What we've actually done is our pharmacy team has access to Verto as well. And so they're keeping an eye on the numbers as they change throughout the day so that they're only thawing what's actually needed and doing that as close to real time as possible so that there's no wasted dosage. We've been managing a bit of a standby list outside, but and that's just more so if you have 500 doses you can get out of all your vials and you only have 499 because someone doesn't show up, we're using a residual list to call just so we don't have any wasted doses, but we're not overbooking to do the no-shows because at the end of the day it'll just come down to finding that sweet number of how many doses you can get out of a vial. But the Verto tool has helped our pharmacy team manage how many are thawed for the day so that we don't have a lot at the end of the day thawed that we don't have arms to put doses into.
Fantastic. Okay, Austin, next question.
And that was the last question in the chat, Jim.
Okay, that's great. I'd like to thank everybody very much. Special thanks to Mike Anderson and Giuseppe Cammisa for their support in today's webinar. I'd like to thank all the attendees. The contact information is on the screen, both email and phone. If you'd like to book your own personalized demonstration, or if you have any follow-up questions that we didn't get to in today's Q&A session at the end of the webinar. Thank you again, everybody, for your time. Have an excellent day.